Here we go. Okay, we're rolling. Stand by.
We start with the perspective of the therapy dog in the elevator. You can kind of see the lower legs and feet of some Gundersen staff or employees as the doors are opening, and then we took a long shot down one of the hallways here at the hospital all the way into the patient's room.
Shooting the point of view of the dog was really interesting. We tried to look into several articulating arms that could be the point of view of the dog. There's several cameras that you can attach, but this was the original. It's called a doggy cam, and it's on the end of an arm, and the weight of the camera actually makes movement like a dog. Our assistant directors brought in extras, which were all the employees at Gundersen, friends and family, put them in the hallways, and it was mapping out everybody's movement for a pretty long distance.
What I'll do is I'll set everybody up. It'll take us a little while. We'll go around. I'll have to be moving you around. You come over here, you go over here. Once we kind of get it set up, we'll rehearse it a few times.
The dog has to move out of different people's way into certain directions, so it actually looks like a dog getting off an elevator, and everybody did a superb job, and it was take after take after take, which even the most seasoned actors would end up getting bored with, and everybody was a champ and everybody worked through it. So I think we did a really great job, seeing as it was such a difficult shot.
My name is Cindy McMullen, and this is my dog Suzy. She loves to do her job as a therapy dog. She loves to visit with patients. Her favorite thing is to snuggle up and in a bed with someone if she gets the opportunity.
I'd love to have her right up here.
Okay, you want her looking at him?
Looking at him.
Okay.
Now you're dropping down to about a 1.2.
And I'd love her head more this side.
Okay.
And and you would kind of be looking down at her.
Okay. She does have a key word that we can get her to perk up her ears and that. So.
What's her key word?
Suzy, are you hungry? Are you? Are you hungry? Yeah.
You say move on.
Okay, great. I like these.
So I'm Donna Sullivan. This is Cato. She's an Alaskan Husky Shepherd, and she's 8 years old. She loves people. She loves to be loved. She kisses. She loves to interact with them. Kids of all ages. People take pictures of her all the time. I don't know that she's ever been on a camera like this.
Cato, we ended up using Cato, and she was wonderful, and I could see how her going to the room does cheer up patients. She cheered me up, you know, for the day. It was amazing.
So let's bring Cato right in front of camera here. Hey, Nathan. Here, Michelle will talk you into the position.
Oh, what a beauty. I love it. I can see Cato therapy too perfectly.
Essentially what we had is a patient that is in the hospital, albeit here at Gundersen, but just out of surgery, maybe a day or two, a little bit bored, kind of wanting to get back home, how we all would feel if we were in the hospital for a couple days. Then we have a dog emerge in the room, a therapy dog, and they bond with one another, which brings happiness to the patient, to his boring day, and just brings a little love there.
We get a nice balance between him being, having this more solemn state, and then seeing the therapy dog and really brightening his day and being just really more jubilant and joyous and happy, and being able to feel more maybe comfortable.
Yeah, even further back, right?
I played a orthopedic nurse that was helping take care of a patient who recently had a hip replacement. I was a nurse in the ortho department in the hospital a while back, and I had the opportunity of seeing real-life patients interact with therapy dogs, and it really was a fun thing to watch because they both really interacted well together.
I think if I was here and to be able to have that opportunity, even just spend a few minutes with a dog would be a very special thing.
I think that we have to always remember that to the patients, this is their experience, and it's hard to remember that when it's your day-to-day grind and the thing that you do day in and day out. So for patients to feel that you really care about them and that you can add love into your care, because it's really a very intimate time for them. So I feel like that is really important for patients to feel that not only is it your job to be here, but that you want to be here and you want to take care of them and treat them like you would want to be treated and that you'd want your family members to be treated, which is with love.